Well, hi everyone, welcome to Center of Balance Live. I'm Phua from Center of Balance, the acupuncturist. Today we're gonna focus on one thing about neck. If you suffer from neck pain, what sort of exercise can you do? Well, I probably showed you some yesterday, but today we just want to focus on it because yesterday we were talking about what to do at home, right? What to do at home. There are a lot of things that you can do at home. Heat pack, exercise, and we did mention some exercise, but today mainly we're gonna talk about is exercise. Just exercise, nothing else. Just exercise. So what sort of exercise should you do? And what did I, as a practitioner, as an acupuncturist, what do I suggest my patient to do? What is the most common neck exercise that I suggest my patient to do, right? So I have been testing it out for my patient, which one is the more common that people get benefit from, right? So the answer is McKenzie neck exercise. McKenzie neck exercise. Okay, you probably heard about that. If you're physiotherapy, well, you're very familiar with that. If you're not a physiotherapy, maybe not, right? Maybe not. Okay, let's have a look. Oh, God, this is got it wrong with this one. Let's start again with that one, right? So I'm gonna set up my Facebook again. Set up wrongly. Yeah. So McKenzie exercise is very, very simple, and everyone can do that, right? Everyone can do that, no matter who you are, and it does benefit a lot of neck pain, but it doesn't mean it can fix all the neck pain. Okay, exercise is just exercise. Okay, it can't fix everyone. Right? You need some. If you need a practitioner in acupuncture or physiotherapy, chiropractor work, yes, you do need that too. So it doesn't mean that once you get exercise, you don't need any treatment. Okay, I don't mean that. Okay, but exercise is something that you can do at home. Now, when I say that a lot of people will benefit for this, it doesn't mean that all neck pain can benefit from this. Okay, I want to point out some neck pain actually make it worse. So how do you know it's gonna suit you? How do you know this McKenzie neck exercise will help you at all? Test it out. Test it out. Just simply follow me and do it. If you watch this video, do it. If you feel uncomfortable, don't do it. I would suggest you go to physiotherapy, acupuncturist, or your doctor and consult with the doctor, right? Now, if you learn this, if you benefit, then that's great. That's great. But to be honest, not everyone will benefit from it. Okay, but majority of neck pain will benefit from McKenzie neck pain, right? Now, first, let's talk about apart from McKenzie neck pain. Okay, McKenzie neck pain is just doing the neck, right? But we need to know one thing: that neck pain is associated with the upper back, maybe the shoulder as well, especially in here, right? So the neck pain can cause headache too, right? Especially in here. Now I'm going to show you apart from Mackenzie neck pain, there is other exercise over here, which I found it myself. I told you I have neck pain in the past, okay? And I show my patient how to do this one as well, apart from Mackenzie neck pain. And some patients, this is a very powerful one. Some patient neck pain, you just need to do that, not even Mackenzie neck pain, neck exercise, okay? So let's start over here, right? So what movement do you have in your neck, for neck? Oh yeah, if you watching this live video, please give you a thumbs up and say hello to me. Okay, it's important when every time you came up to say hello, Sunan, how are you? Something like that. Good morning. We have morning here, maybe afternoon or night time for you. Doesn't matter. Just say hello and give me a thumbs up. And further on, tag your friend, tag your family, whoever suffer from neck pain into this video, because they're gonna benefit from this video. Okay, and what else? Share this video. Oh, something dry in here. That's good. A good dryness in here. So, and share this video with your friend. If you replay this live video, you can speed it up on Facebook, and I'm not quite sure about Instagram, but on Facebook and YouTube, you can speed up. You can, that's some icon in the left down in the setting area that you can speed up to 1.25, 1.5, or whatever, okay, to fast forward. All right, let's start. Let's check. Is there anyone in here? Let's have a look. Okay, now let's start. This is something that I want to show you today. This keep turning me off. I'm not quite sure what happened. Oh, that's because I haven't turned it on yet on my Instagram. Okay, this is Mackenzie neck exercise. Okay. As you see, we have this curve in the lower back. So that is when I sit like this. Oh, sorry. Let's do this. Okay. When I'm facing over there, and that's the spine. It's not very straight, that spine. Okay. If you look at here, this is from the back, it should be straight, one straight line. Right? One straight line. Okay, it shouldn't have any curve on it. But of course, this one has not been properly treated, so it's a bit imbalanced. But in the side way, if I'm facing that way, this is facing that way, okay? Then you see that curve in here, and that curve should be C like this, and as well as here, right? So this curve, lumbar and thoracic, is curving like this. Okay? Then thoracic is curving that way. Right, so they are different. In the middle is that thoracic, and neck is curving that way. You see? Then lumbar is curving that way as well. So when we know this, if you want to do exercise, make sure, I'm very good, thank you, Ali. So make sure you sit right up or stand right up. Okay, sitting is the best position to do the neck Mackenzie neck exercise. Why is that? Just in case when you turn your head, you get dizziness. If you're standing, you get dizziness. No kidding. You don't want that to happen. Okay. So you want to sit down properly or sit on the floor. Even better if you be able to sit on the floor. Not everyone can sit on the floor, because sit on the floor can be uncomfortable. Or sit on the chair like me right now. Then what happens is you need to make sure your back is straight. And how do you make sure your back is straight and you get the curve in here? This one. Simple. Go back. Bend backward. Okay. So you sit straight and bend backward a little bit and come back a little bit. So come back a little bit. Okay. So if you go to extreme and then you come back a little bit, and that is straight. Then you don't have to do your chest. The chest, you don't have to go back like this. The chest, you only need to do, the only thing that you need to do is your both shoulder shoulder blade on the back over here. Go back and relax. Then you go back, open your chest, hold it backward, and squeeze it together and relax. Okay, so hold it back, squeeze it together, and relax. And you know this is right now. So you know this is good now. So lumbar first, thoracic, then neck. Okay, neck is the important one today. Hi, good morning, Veronica. Ali from Iraq. Thank you. I know that. Thank you. So the next thing you need to do, sit properly, lumbar, thoracic, then your neck. Your neck, you want to maintain this curve. It's easy. It's so simple. Okay, I'm going to do it in front of you first, then I'm going to do it sideways. Okay, just tuck your chin in. Okay, use one hand and push it in. Do it with me. Do it with me. Okay, you need practice with this. Okay, if you don't do it with me, you're gonna lose it. Okay, you're not gonna get it. Okay, do it with me. So tuck your chin in, and when you tuck your chin in, relax. Tuck your chin in, and let it naturally fall back to what it was. Okay, here you go. That's it. Okay, on the side, tuck your chin in. Relax. You get me? So tuck your chin in, relax. That's it. That your all spine are straight right now, and you will have the curve for your them. Right? Then what happened? The first move of Mackenzie exercise. Now, let's not talk about Mackenzie exercise. What can you do? What movement? What range of movement can you do for your neck? Now we can do sideways, right? Try it. You can do sideways. And now when you try it, feel it. Just feel it. Is there any tenderness or pain or tightness in your neck? Either side when you do this. Now, if you do, mark it down. Remember first. Then ask yourself, try doing it. Is it out of 10, how bad is that? And how far can you go? How far can you go? You probably can't see how far can you go. Maybe someone else check it for you. It'll be better. Okay, now feel the pain or tightness. If you can feel it, mark it down. Remember where is it, which position you get it. Then backward and forward. Okay, and again, feel the pain and tenderness. Okay, feel the pain and tenderness. Then bring your ear to the side. Okay, for me today, when I do backward, I feel a bit tightness in here. Nothing in here. When I do sideways, I feel a little bit tightness in here, just a little bit. And pretty good in here, right? So when you're backward, I feel that side. When I go that side, I feel in here. Out of 10, the tightness, just about 1. Not much at all. Not much at all. How about backward? Forward. Forward, pretty good. Forward for me, pretty good. Okay, bring the ear to the side. Yeah, a bit of tightness in here. Just about more than 1. It's about 2. If I go to very extreme and try pull it, yes, a little bit, about 1. Okay, on that side, right? That's it. Let's start do the Mackenzie neck exercise. Now, Mackenzie neck exercise. The first thing that you need to do, we're gonna go through that side every way. The first thing you're gonna do is tuck your chin in for 10 times. So I want you to do it with me. Okay, do it with me. Tuck your chin in. How do you sit right up? First, again, tuck your chin in. Okay, this is how you tuck your chin in. 1, hold it for 2 seconds, relax. 1, 2, relax. 3, relax. 4, relax. 5, relax. 6, relax. 7, relax. 8, relax. 9, relax. 10, relax. 10. That's good enough. I want to point out some people when they do that, so it's better for you to in front of the mirror because you can see what you're doing. Because if you try to do this, and some people do this, it's not knocking your head, okay? It's not going forward. It's just on the same level. Okay, you go okay, back, forward, back, forward. Okay, this is something you should do. Okay, so if you just be yourself, if your patient do it, you can tell. So first learn it yourself. If you don't know how it works, you don't know how to do that, you can't show your patient at all. Right? If you are patient and you suffer from neck pain, do it in front of the mirror. Do it in front of the mirror so you can tell. Okay, so you can tell. Okay, no matter what you do for the following one, okay, which side that you're going to have your tenderness, tightness, okay, you need to do the first one. Okay, this is the basic for 10 times first start with. Okay, then, and I do want to point out, if the following one, any of them you can't do it or you feel pain, discomfort for it, at least this is the one that you need to do. If you can't do any other, it's fine. You keep doing this until you get relief. Then you start to do those. Why is that? Because this one keep pulling the curve back to your neck. When you have maintained this curve, the muscle on this position, all muscle in here, it won't be tight. It will lose it up itself. On the right position, the muscle will lose it up itself. Okay, remember this. Second movement. So do it with me. So basic movement first. Number one, exercise first. Based based on this, you slowly go back your head. Now look at that. Based on this, you go back. That's it. I can't go any further. Okay, it's a bit awkward. Look a bit awkward. Yes, I know. But if you don't tuck your chin in, you just do this. You see, I can do much further. But if I do this, listen, I have to keep touching, tuck my chin in, tuck my chin in, while I am going backwards. Okay, if I don't tuck my chin in, I do forward, backward. So this is how far I can go. But if I tuck my chin in, you have to keep touching it, tuck the chin in. That's it. I can't go any further, right? So in this one, you're gonna do this. Tuck the chin in, go back, that's it, and then stop to do this for about 10. Count to 10. Relax, okay. So tuck the chin in, go back, and go your head go to sideways. Okay. Come back, chin in, backward, to the in. That's it. Chin in again. Good. That's about 6. Let's do 10. 7, 8, 9, 10. Right. Now, if any of you, when you test it out yourself, you went backward and you feel the tightness, now you can try it again backward. Remember, I have tightness in here a little bit. It's gone. It's gone. You know, pretty simple. Pretty simple. All right. Now, what about forward one? Forward, simple too. Tuck the chin in. Forward. Now, without touching the chin in, you go forward. You can go, you see, much further. That's out of your range. You shouldn't do that. Why is that? Because your neck won't get any support. It's very easy to hurt your neck. Okay, but if I do this, I can't go any further. It's different, you see, on the sideway. I can look down much further. But if I tap my chin and first, oh, I can't. I can only do it over there. You see what I mean? So 10 times. And this exercise, you can push your head as well. Okay, that's how you push your head. Okay, tuck your chin in, go in, and give it a little bit more pressure. 1, 2, relax. 2 seconds, not longer than that. You don't have to do much longer than that. Okay, tuck your chin in, go further, go to extreme, and push it a little bit. 1, 2. When you push it, if you forward, you feel the pain, do not push it. Okay, anything that you feel the pain, stop it. Pain means stop. Pain means stop. You need to understand that. Pain means stop. But tightness means you can go a little bit further. Okay, when you go a bit further, how do you do that? You can't just go any further. Use your hand, push it a little bit. Just put it a little bit. Then you feel even more tighter. But don't keep pushing it. Just push a little bit further, stop there for 2 seconds, then release. Okay, that's how you do it. 1, 2, relax. 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 7. 1, 2, 8. 9. 10. Okay. After this, you find that people can't bend forward. They can bend forward further now. Even if you can measure yourself, you probably just do this, and now you can do it further. Okay. Now when you do forward after forward exercise, you go backward right now. You'll find it even easier, even further. You can go back further. You can go forward further. Okay. Now, now when I first start, I go there. I feel that the tightness, but now I feel it in here. No longer over here. I feel a little bit because that one it was shorter. Then now it go further. It got more string to get further. Then now it's that one. When I go back, it's that in here now. So it's similar to here. When I do this, I feel it in here, right? The same muscle right now. So how do we do this? to get rid of this. Simple. Now, I normally suggest if you do this, I feel tight a little here, but nothing in here. I suggest you start from here. Nothing in here. When you go there, start in here. How do you do that? Again, the basic exercise is very important. Always start with the basic exercise. Okay. Hi, Muhammad from Iraq. Thank you. Thank you for joining us. So tuck your chin in. Go to the side. And you can push it a little bit. 1, 2. Tuck your chin in. 1, 2. 1, 2, 3. 4. 5. Okay. Now in front of you. Push it. 1, 2, 6. 7. 8. 9. 10. That's it. Okay. Now we're gonna do the other side. So remember, I have tightness in here. I have tightness in here this morning. Now when I do this, I can get rid of it. Okay. If I can't, I can do further. Tuck in. Go in. I feel the tightness, no pain. So push a little bit. 1, 2. Here we go. Okay. Do this. 6. Hold it. 1, 2, 7. 8. 9. 10. That's it. So we're gonna test it out and see how the result is. Hi Eric, how are you? Thank you for being here. So please give me thumbs up when you go up, when you look at watch this live video, and say hello to me, and remember to tag your friends in. Okay. So let's have a look. What can we do right now? Whether I feel the tightness or not. Compare with the other side. Tightness gone. Tightness gone. Okay. Now I would say it was about 1 or 2, right? And down to no, not even 0.5. I hardly feel it. Okay, I hardly feel it. Okay, that's pretty good. And that both sides I can feel tightness. Okay, it's actually loosen up when you do this. I can't really feel the tightness. It was about 2, right? And now probably 0.5 to 1. Okay, now how do we do this? Tuck the chin in, ear go to the side. Then how do you get it further? It's no pain. It's just a tightness. I can use this hand, go there, and push it further. 1, 2. That's it. Tuck the chin in, go to the side, pull further. 1, 2. Tuck the chin in, pull to the side, further. 1, 2. Chin in, side. 1, 2. Okay, on the side. So I want you to do it with me. You tested out your neck, you know where it's tightness, do it with me. I think it's about 10 now. Remember, you only push it if it's just tightness. If it's painful, don't push it any further, okay? Right. Pretty good now. So the other side. Tuck chin in. 1, 2. Only tightness, so I can push it. Even if you have no tightness, no pain, then you can push it further, okay? Only with pain, you stop, don't push it. 1, 2. 1, 2. When you push it, you only push it a little bit, okay? Don't push it too much. You're gonna hurt it, okay? You're gonna go to extreme already. So don't start to push it. You just tuck the chin in, go in until you can't go any further. You feel a little bit tightness or no tightness, just give it a little push and stay there for 2 seconds. Push a little bit. 1, 2. Can't go any further. Push a little bit. 1, 2. Go. Can't go any further. Push it. 1, 2. 1, 2. 1, 2. That's it. So let's test it out. Pretty good. Pretty good. Pretty loose. Okay. Now, I'll tell you, if you have, after this, you still feel some tightness, that's okay. Leave it. Leave it. And you can do the further one. It may help even better. Okay. Then if it helped you with your neck pain, do it once every hour. Once every hour. Or you find it help the neck pain, then do it twice every hour or once every hour, once every 2 hours. Whenever you get pain in your neck, because some pain is comes and goes, right? You want to do it regularly as well as when the pain occur, right? So the next one is important. It's not in the McKenzie neck exercise, and in Chinese medicines that I learned it from school, and this is very, very useful. I know a lot of people know already, and physiotherapy do that as well, and I find it very useful, and it works for majority of neck pain. Right, so this is the one. All right, over here, scapula squeeze together. Scapula squeeze together. But with the scapula squeeze together, I want you to sit right up again. You don't do this, sit like this, and you try to do this. That's not right. You're gonna hurt yourself, all right? So sit right up, okay? Then you can stand up, do this. You can sit, do this, fine. Then both open your chest. Then use your hand, cross over together, and squeeze it together. Before you do that, when you sit right up, you tuck your chin in. Tuck your chin in. You can sit and do it. Squeeze together for 5 seconds. Squeeze 1, 2, 3, 4, 5. Relax. Okay, and do it again. Tuck your chin. Sit right up. Tuck your chin in, and squeeze together. 2, 2, 3, 4, 5. Relax. Right? Or you can hold it for 3 seconds if you wanted to. No need to be 5. Okay. So further on, what can you do? Tuck your chin in, squeeze together, and your head bend backward. Relax. Tuck your chin in, squeeze together, backward. Okay. Do it for about 5 to 10. Relax. Squeeze. Head backward. Relax. Squeeze. Head backward. Relax. Squeeze. Head backward. Relax. Okay, you can do it 5 or 10. Okay. You find that your upper back loosen up, especially when you have neck pain. You have this problem associated with here, and I will tell you, sometimes you don't feel in here, but your neck's painful or tightness in there. You squeeze all your upper back here, and you loosen up, and then you do it again. But now, wow, you find that you can go even further. And the tightness, if you still have some tightness after McKenzie neck exercise, after the upper back, you find, wow, that help you even further, right? Now, in some back pain, neck pain, you started with the last one I just showed you, and you felt, oh, much better. Okay, then you carry on with McKenzie one. Okay, McKenzie neck exercise. So you can do McKenzie one first or the upper back one first. Doesn't really matter. It doesn't mean that there's no order that you have to do this before you do this. Okay, no, there's no order. But with McKenzie one, I really suggest that you do this one first. Always go for this for 10. Again, if you don't have time, you don't have to do the whole set. If you go there, you feel pain, okay, go there, you feel pain, okay, you feel tightness, you can do this 10 times and straight away go to that one. Okay, you can skip the others. You don't have to do the whole process depending on how much time you have. Okay, does that make sense? So this is something that you can do in the office. You know, simple. Do it in the office. You take some break, and in front of the computer, you do it, and you feel better. And of course, the computer is important. Does it, you're looking at a computer that way or that way, it should be in here. So I put all my computer on my headline. Straight away, I don't do this. I don't want to do this, okay? Then your keyboard needs to be over here, okay? Over here, all right? So that's it for today, and hopefully that you find this live video help and you got a lot of information out of it. Now, we're going to see you tomorrow, and this is another episode of neck pain, but I especially want to show you the neck pain exercise, okay, neck pain exercise. And I want to thank Mr. McKenzie. He's a Kiwi and New Zealander. I'm not quite sure he's still alive or not. The last I saw him, he was 90-something years old, and a review, and he lived in Wellington. And then I was trying to join the class workshop to learn, but unfortunately I'm not allowed, or wasn't allowed to. I'm not qualified for it because I'm not a physiotherapist. But hey, I'm an acupuncturist. We learn all this. We learn all, all this thing in the school, But yeah, unfortunately, I'm just they not allow me to learn it. But anyway, when I want to learn something, I find a way to learn. What do? Mr. McKenzie has a book. Okay, so I bought the book. And I read it myself, and everything's in the book. And how do you get great of it? I practice this myself. I do it myself. I figure it out. What's good, what's not good. Then I get my patient. I teach my patient. I taught my patient, show my patient how to do it, and my patient get benefit from it. That's how I learned McKenzie neck exercise. To be honest, I never been to any workshop of Mr. McKenzie, but I appreciate that Mr. McKenzie developed this exercise that has been helping a lot of people. Most physiotherapy know about Mr. Mackenzie, and they learn it in the school. So I want to let you know, as an acupuncturist, open your mind. There are a lot of things that we can learn. We can learn from physiotherapy, chiropractor, osteopath, of course. You need to know who you are. You're an acupuncturist. We can use those exercise as 导引 or 动气. While the needle in, you show your patient to do those exercise and get even better results. All right, stay awesome. I'll see you tomorrow. Bye bye.